Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends that are impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team at Inovalon, and joining me today is Michelle Spurlock, the Chief Nursing Officer at Acadia Healthcare. And today we're going to talk about nurse scheduling, leveraging technology to reduce burnout and improve operational efficiency. Thanks for being here today, Michelle.
My pleasure.
So before we get started, just tell me a little bit about yourself and your role with Acadia.
Sure. So as you mentioned, I'm the Chief Nursing Officer for Acadia. I've been there a little over 5.5 years, but I have worked in the behavioral health field my entire nursing career, which is well over 30 years, and we'll just leave it at that. But as you can imagine, staffing and scheduling has been a huge part of the role in a nursing leader's life cycle. Having staff at the bedside is just critically important.
And, you have said in working with our team before that building a resilient workforce is an art. You can't look at scheduling as a task. Really like that quote, but give me a little more. Tell me what you mean by that.
So when you are staffing a nursing care unit and the staffers of the past just looked at an open shifter position, they might call everybody on their list just to find somebody to fill that spot. But when you look at the patient, you have to look at, well, what's the skill mix need for that unit? So, in the old days when everything was done on an Excel spreadsheet or paper schedules, you didn't have that transparency to see what was happening. And so with using Inovalon's product that we're using for workforce optimization, we're able to look at the skill mix, looking at experience level to make sure that we're putting the best person at the bedside of the patient. So it really is more of, like I said, an art. Making sure that, for example, we're not moving staff across multiple units, but we have more continuity of care. In behavioral health, the length of stay is longer than for, say, your med-surg type of location. So it's really important that we maintain consistent staffing as much as possible for the benefit of the patient, and that just allows for, I think, a much more therapeutic environment.
Yeah, absolutely. That makes sense. And now kind of looking at diversity in scheduling, that can often mean demographics, but when it relates to nursing, it can also mean level of experience with your staff. So how does a diverse workforce help better serve patients? And how do you build and maintain a diverse workforce?
Again, going back to the expertise of the staff, one of the things that I work with nursing leaders is to build a profile when they have a vacant position. You need to look at the team that you have for a particular unit, whether you have in behavioral health, maybe we have an older adult unit or an adolescent unit. So I want to make sure that I'm creating the profile for that population. So a nurse who has the background with adolescents or geriatrics, I want to make sure that I place them correctly. So that's what we mean by diversity. Also being sensitive to the experience level of the staff. So if I have a brand new nurse on a unit, I want that nurse to have a positive experience by hopefully working with a more experienced nurse to be their mentor. And so all of that plays a role in the success of scheduling.
Okay. And I think another big part of all of this is technology. And, would love to know how you've been able to use technology, even outside of the Inovalon product, to help prevent burnout and kind of minimize that overtime component.
Part of it, of the way that we are able to prevent burnout or minimize overtime, would be looking at that balancing of a schedule. Again, going back to paper days, it was very difficult to look at the staffing across an entire hospital, much less an organization. But we now have the ability to look at a schedule and can see where maybe we have some units that have more staff, others have less, so that we can appropriately move the staff around. The other thing that it's done through technology is just, instead of having to pick up the phone and call 30 people because you have shifts to cover, you're able to send messaging out. And so that has really helped to expedite the process.
Yeah. So technology has already, really helped in scheduling and really so many areas of healthcare. But looking ahead, how do you plan to innovate and leverage technology in the future?
One of the things I'm asking is to look at a way to indicate within the staffing schedule someone's experience level and their areas of expertise. Right now, I see their name and I can call and have them pick up a shift, but I'm wanting to see if there's a way to denote within the schedule their experience level so I can look at a unit and I can make sure that I have the diversity that we want. I mean, right now, I know anecdotally, but I would love for the system to be able to tell us that. Also, to be able to have reporting to see if someone's picking up, they're working too many shifts. They perhaps are working frequently where someone's coming in late, so they're having to stay late. I think all of that impacts workforce satisfaction, and if we can have reporting that allows us to look into that a little bit more clearly, then perhaps we can be more proactive instead of someone just giving up and quitting their job because they're tired of working so many hours.
Yeah, absolutely. And I mean, the way technology is advancing and the rate at which it's advancing, I'm sure if we were to get together in a few months and have another conversation, there will be even more advancements that are helping kind of achieve those goals for you. But today, just kind of to close, any advice that you would give to another CNO at a similar organization who is looking to keep staff happy, keep operations running smoothly?
So I think that we want to clarify what keeping staff happy means. Some newer nursing leaders think that means when they want special privileges for schedules, or I can't work weekends, or I can only work so many days a week, that they have to give in to every request. But then what happens is that your really dedicated staff that are working every other weekend, they get really tired of that. So I think there's a balance. So keeping staff happy is not just acquiescing to all their requests. It's a matter of looking at that balance. It's looking at being fair and equitable. It's making sure that there's not favoritism. Everybody has an opportunity to customize their schedule or to pick up certain shifts. So again, fairness and equity is really important to keep your staff happy. It's not always giving in to exactly what they're asking for in terms of their schedule.
Got it. Well, I think that is certainly great advice and kind of wraps up my questions for today. It has been great to sit down and talk to you, Michelle. Thank you so much for taking the time.
Thank you. My pleasure.
Okay, and also thank you, of course, to our audience for watching, and be sure to check out our next episode of INOvators coming soon.